And my name is Roberta Robinson. I'm outreach manager for the geriatrics. And we welcome Salud es Vida. They are on Facebook Live, so benvenuto. And also, I have a couple of things. If everyone could mute themselves, please. And when we put our questions in the chat, if you could only limit it to questions only. And if the doctor needs to get some more background information, she'll ask for that. Today we are joined by Dr. Ann Bruno-Murtha, she is the Chief of Infectious Disease with the Cambridge Health Alliance. So this is still remains a hot topic, boosters and more, and it's ever changing in this climate. So thank you for taking the time to be with us, Dr. Bruno-Murtha. And if you could just begin and enlighten us on this subject, that would be fabulous. Welcome.
Thanks, Roberta, and good afternoon to all of you who have joined this presentation. I'm glad you're here, and I hope you could spread some of the knowledge that I share with you this afternoon. So what I hope to do in the next 15 minutes or so is give you an update on the latest COVID-19 vaccine recommendations. And you know, there's been a lot of new recommendations, and even though I deal with this day in and day out, I find it confusing. So I can only imagine how it is for you. So I hope to simplify it and answer any questions that you might have at the end. And I really want to emphasize, we are at a different place in the pandemic. We are at a much better place, but we are not out of the woods yet. And so I want to emphasize that it is very important that all of us get that first booster. That is so critically important. And we'll talk about the second booster too, because that is available for many individuals. And we'll talk about who should prioritize that second booster. But clearly the first booster, that's the shot after you completed your primary series. So after 2 Pfizers, after 2 Modernas, or after a J&J or Janssen vaccine, it is critically important that everyone come forward and get that first booster dose. And I'll review why that's important. And then we'll discuss the eligibility for the second booster dose. And I will share some of my insight as to who should prioritize getting that second booster dose. And then I'll provide a glimpse as to what we can expect over the course of the next month. The FDA and the advisory committee to the FDA have a very busy schedule, and we are very optimistic about authorizations for a pediatric vaccine down to age 0 through under 5 years. So a lot of excitement is anticipated in the month of June. So why are boosters important? You know, the vaccines have been really incredibly effective, a miracle that we've all witnessed. And really, it's the reason why we are in a different place in this pandemic. We are not seeing the mortality that we saw in March of 2020 and throughout the early part of 2021. And that's because the vaccines have been so effective. Having said that, they're not perfect. And what we are seeing is that as new variants have emerged, particularly during this past surge in January, February, and continuing now, the Omicron period, we have seen that the efficacy of the vaccines decline with time. However, they still maintain robust activity against really severe disease and certainly against critical disease. We are not seeing a lot of patients in our critical care units. Thank God for that. And it is really because of the vaccines and actually some of the therapeutics that we have now as another tool in our toolbox. So the boosters are important because if you just have the primary series, we know that your immunity is beginning to wane. And we start seeing that as early as 4 to 5 months after the second dose of the 2-dose mRNA vaccines. And it's more prominent with the newer variants like Omicron. There's also evidence emerging that booster doses may also prevent long COVID. Those are the symptoms that go on after somebody experiences COVID and persist for more than 4 weeks. And they can be disabling symptoms. So any attempt to decrease the risk for long COVID, I think, is worth the effort. Let me share some data with you to show the effectiveness of the mRNA vaccines, the vaccines like the Pfizer and the Mrna vaccine. And this is during the Omicron period. So basically toward late December of 2021 and through our current period of Omicron. The top of this slide looks at the vaccine effectiveness against having to seek medical care either in an emergency department or an urgent care clinic. So for all patients who completed their primary series, that's the 2 doses, if they were within 6 months of the second shot, they still had very good vaccine effectiveness, 86% effectiveness against having to go to the emergency department or to an urgent care visit for COVID. But as you see here, as the time from that second vaccine increases beyond 6 months or 180 days, we see that the vaccine effectiveness against needing to seek medical care drops to 76%. So it drops, but if you get a booster or that 3rd dose of vaccine, you restore vaccine effectiveness to even a higher level than it was after the 2-dose series early on in the course of your vaccines. Now, if we look at hospitalizations, the vaccine effectiveness hasn't been as good. So if you are an individual who only received your primary series and you are within 6 months of that 2nd dose, you have a 52% vaccine effectiveness against needing hospitalization. If that 2nd vaccine was 6 months or more than 80 days ago, essentially your vaccine effectiveness against preventing hospitalization is only 38%. That's pretty lousy, right? But if you get a booster dose, the 3rd dose, you could restore and actually improve and enhance the vaccine against having to need to be hospitalized for COVID. So this demonstrates that 3rd dose is extremely effective at preventing hospitalization or the need to go to the emergency department or to urgent care for COVID symptoms. So the booster recommendations for healthy adults currently are that all healthy adults who received a Pfizer or a Mrna vaccine at least 5 months ago, so the 2nd dose was at least 5 months ago, you are now eligible to get a booster of either the Mrna or Pfizer. And you can mix and match. You don't have to stick with the same manufacturer. If you received the Janssen vaccine or the J&J vaccine, as some people know it by, and it's been 2 months since you received that, you are eligible to receive a single booster dose. And that booster dose should be an mRNA vaccine. So it should be either the Mrna or the Pfizer vaccine. If you are 50 years of age or older and you received your booster dose and it has been more than 4 months since you received that booster dose, you are now eligible for a 2nd booster dose. And that is relatively new. And that is something that you might want to consider. And we'll talk about, how do you weigh the risk benefit in getting that 2nd booster? And we'll talk a little bit more about that in a little bit. If you received the Janssen vaccine and a booster dose, and it's been 4 months since you got that 2nd dose, you are also eligible for a 2nd booster dose of either Pfizer or Mrna. And the importance of the 2nd booster dose is it enhances what I demonstrated to you, protection against hospitalization, severe disease, and death. Well, what about kids? Kids 5 through 11 years have had access to vaccines, the Pfizer vaccine, that's the only one that's authorized for our younger kids. And now the newest recommendation, and this is very new, that they too are eligible to receive a booster dose of the Pfizer vaccine. So so if you have children, grandchildren, nieces, nephews, please bring this news home to your family and to your friends, because this is a new recommendation. And we need to do, honestly, we need to do better at getting our children vaccinated. They have not been as well vaccinated as I would like to see to keep them safe. And we know that although kids generally, and I say in general, do better with COVID, there has still been 1,200 pediatric deaths due to COVID-19, and that is just heartbreaking. And we do see hospitalizations. There have been more pediatric hospitalizations during Omicron than during any other period in this pandemic. So it's critically important not to neglect our kids. And we know that the CDC and the FDA has looked very carefully at the safety of these vaccines before they went ahead and authorized a booster dose for our 5 through 11 year of age children. And here's some more data. This is data that's compiled by the CDC that shows the benefit of having the booster dose. So if we look at cases, this black bar here looks at cases of COVID-19 during the Omicron period. So this is January, February of this year. These are unvaccinated patients, and you could see a big spike in cases among unvaccinated individuals. For those individuals who received the primary series, so 2 mRNA vaccines or one of the J&J vaccines, you see a marked decline in the number of cases of COVID-19. But what's even better is if you have the primary series plus the booster dose which is recommended, and you could see that these individuals, those that have been boosted or have received 3 doses, have a lower incidence of COVID-19 infection. Then if we go to the right of this slide, we see deaths, and you could see the marked increase in deaths among individuals who are unvaccinated compared to those who just completed the primary series, and a very small number of deaths among those individuals who were boosted. So you could see in a nice graphic form the value of that booster dose. This is another slide, and this is a busy slide, but I just want you to concentrate on these green dots. These green dots reflect individuals, healthy individuals who do not have any immunocompromising diseases. And you could see that with time, so essentially every 2 months after the second dose of an mRNA vaccine, there is a diminution in the vaccine effectiveness against hospitalization, and it declines with time. And that's depicted here. So the green dots are getting lower with every passing 2 months. And you could see when you get beyond 6 months, you're on average, your vaccine effectiveness, if you only have a primary series, is between 60 and 70%. However, if you get a 3rd dose or a booster, you restore that vaccine effectiveness against hospitalization to above 90%. In fact, it's 93%. And although there, again, is a slight diminution in vaccine effectiveness, it is far more robust with the 3rd dose as compared with only 2 doses up here. And we see that, unfortunately, for immunocompromised family members and friends, the vaccines just do not work as well in those individuals. And the vaccine effectiveness against hospitalization is much, much lower. But they too also do improve with additional doses of vaccines. And actually, immunocompromised patients are eligible now for up to 5 vaccines, plus they have a preventive monoclonal antibody that they're eligible for. So we can do some things to help our immunocompromised patients stay out of the hospital from this virus. So the second booster, let's talk about that. Some people are now eligible for a second booster of an mRNA vaccine if they're 4 months beyond the first booster. The caveat for, and I should have mentioned earlier, for our younger kids, the 5 through 11-year-olds, their booster, their first booster is 5 months after their second dose, not 4 months. So there's a little caveat in terms of timing. But for adults and for all other eligible individuals that are interested in a second booster, it's 4 months after your first booster, you are eligible. And that eligibility pertains to all people 50 years of age and older. It also includes all adolescents 12 years of age and older, and all adults who are moderately or severely immunocompromised. And that could be they are immunocompromised because of a certain disease or because of a medication they take, like steroids or biologics or arthritis. So there's a number of medications that we know are very effective at treating many conditions, but they do cause impairment of immune function and make them immunocompromised. And then all individuals 18 years of age and older who receive the J&J or Janssen vaccine, and if they are 4 months out from their either 1 dose or even their booster dose, they too are eligible for a second booster dose. Now, these are some of the things you might want to weigh in your own mind as to whether you want to get your second booster now or not. Do you have underlying medical conditions that put you at greater risk to have more severe disease if you get COVID? And I'd say if you have a medical condition that puts you at increased risk, don't wait, go get that booster now. Certainly if you're immunocompromised, I would say, don't wait and get it now. Or if you're living with someone who's immunocompromised and they're at obviously increased risk for more severe disease, do them a favor and get your booster dose to help protect them and add another layer of protection around their bubble. If you are at increased risk for infection, either by virtue of your occupation or living in a congregate setting or other activities, you might want to think about getting that second booster if you haven't already. And then, and this is important because honestly, right now, it pertains to all of us. If we are living in an area where the community level of COVID is medium or high, we should probably prioritize our second booster dose. And if you're wondering what our community levels is, this is the latest data. You could see Massachusetts here is almost all red, meaning we are high. There's a couple communities or counties in the western part of the state here that are medium. So essentially, we're all presently living in counties with medium to high COVID-19 community levels. And what makes us considered high is because we have more than 15.5 admissions for COVID per 100,000 population. So that puts us into the high category. And our current rates of COVID are more than 355 per 100,000. And honestly, that's a gross underestimate because many people are doing home testing, and home testing is not part of this case rate. So people who have had COVID-19 within the past 3 months, honestly, you could wait. You could wait because we know you're pretty well protected, at least for the next 3 months. So that may be one reason that makes sense to delay getting a booster dose. And if you're an individual who's really hesitant about getting a booster dose and you're like, well, I'm either going to get one now or I'm going to wait to the fall when they have a tweaked booster, it's very likely they will have a tweaked booster that will improve our immunity against Omicron. Then maybe that makes sense. If you are decided you're only going to get one more vaccine and it's either now or in the fall, then you might want to wait to the fall. So what's happening in June? June is really exciting. On June 15th, the VRBPAC, that's the advisory committee to the FDA, independent group of experts, will discuss and make a decision regarding both Moderna's vaccine and Pfizer's vaccine for children under 5 years of age. Very exciting. And then in late June, they will also discuss the next generation of COVID-19 vaccines that we expect will be deployed later this fall. So with that, I am going to stop and leave time for questions. And I'm going to stop sharing my screen so I could see participants.
That was wonderful.
Well, I guess you did your job because we don't have any questions in the chat here. You just answered my question. My question that if I didn't get the second booster, would it be prudent to wait until the fall to get? Because I know a lot of people were asking that. So thank you for answering that question.
So I think that I had to make this decision myself. So I'm eligible for a second booster. And when the criteria first came out, I sat tight because at the time when it was authorized, we were in a much better place. Our community rates were lower, our hospitalization rates were lower, and we were not in the red. And so I said, you know what? I'm healthy. I don't have risk factors for more severe disease. And so I sat tight. But when I saw those community rates start going up, and I started hearing of friends and family members who I knew were playing it safe and wearing masks out in public, still getting infected, I decided it was time for me to get my second booster. So I did. So that's how I made the decision for myself. It really is a personal risk benefit decision, I think. But given the high community rates, and as I demonstrated to you, we're in the red now. I think it's a good time. And you're not gonna, if you get vaccinated now, you're not going to be ineligible for a better vaccine that might be available in the fall. I think that if you wait till September and the new vaccine isn't available to November, you might have to wait a little bit longer. So I weigh that in my decision as well.
You know, as I travel from store to store, I see many people that are not wearing masks anymore. I still put mine on when I go into a grocery store, and I just came back from a trip, and there were some people on the plane because, you know, they changed that recommendation and lifted that restriction, but I still wore mine in that close quarters. So is the recommendation still to wear a mask?
Yes, in fact. So according to the CDC, if you want some good guidance, certainly in communities that have high community COVID levels, we should all be wearing masks in indoor public settings. But sadly, as you point out, Roberta, that's not what's happening. You know, America is over with the pandemic, but the pandemic's not over with us. And I wear my masks when at work. When I'm at the hospital, we all have to wear masks. And, you know, when we're in a healthcare setting, it's very different. I feel much safer at work. Everybody's masked. And honestly, we know our healthcare workers are not getting sick at work. They're getting sick out in the communities when they're going out and they're trying to resume their normal life. And they may be wearing masks, but they're probably the only ones. So I would say, yes, we should all be wearing masks in indoor public settings, given the current rate of COVID in our communities.
One more question. Are antigen tests accurate, and when should people rely on them?
Yes, I think antigen tests are a very good tool, and we should be using antigen tests anytime you have symptoms that concern you. And don't assume allergy symptoms or your allergy symptom. That's when you should test. So if you're having allergy symptoms, I think we're all having allergy symptoms right now with the pollen, you know, and you're going to visit family or friends or a vulnerable individual, or you go into a crowded setting, it would be wise to test beforehand. And they are accurate and they can be used. If you are symptomatic and your antigen test is negative and you want to pursue a nucleic acid or PCR test, I think that's wise too. No test is perfect. Not even the PCR tests are perfect. So you can't completely rely on a negative antigen test if you have symptoms that are progressive.
How effective are the antiviral medications?
They are amazingly effective. So we have a number of different antiviral medications that we could use right now. Paxlovid is the #1. It's not for everyone. There's some drug-drug interactions that make it, not appropriate for all patients, but the majority of the patients can qualify for Paxlovid, perhaps with some medication adjustments with their other medications that might interact. But we have other antiviral medications. So Paxlovid is 88% at preventing hospitalizations if you start taking it within 5 days of your symptom onset. So key is you have to start it early. If you don't start it early, you're not going to see that effective. We have a couple other antiviral medications. One's a monoclonal antibody, bebtelovimab. Also, we're finding it very effective. It is an IV injection, but it's a one-time dose, and you have to go to an infusion center to get that, but very effective, very similar efficacy in preventing hospitalization. We also have remdesivir, another IV medication. That's an infusion, and we have to administer that at an infusion center as well. It's over 3 days, but extremely effective. And both bebtelovimab and remdesivir are available. And I could share some news. CHA is actually taking over the COVID treatment infusion center in Everett. So we will be having our own infusion site for our patients, for our communities. You don't even have to be a CHA patient, and for outside referrals. So very exciting. It will allow more access for our patients to get these tools. And there's another medication called molnupiravir that doesn't look as effective and really hasn't been prescribed much, but it might be the right drug for the right individual. So we actually have 4 therapeutics right now. And I don't want to neglect the treatment that we have for immunocompromised patients, Evusheld. It's a preventative medication. So it's something we give our immunocompromised patients to help protect them against infection. And it's addition to their vaccines. And that is something we could also administer through our infusion center over at the Everett site, and also in some of our clinics. So we have a lot of tools now, but the vaccines are, I think, probably the most effective tool, particularly getting the booster if you haven't already had that booster. So critical.
Thank you. One more question. If you just had the shingle shot, should you wait until later for the first shot or for the second booster?
So if you just had the shingle shot, I would probably wait 2 weeks. That's a very reactogenic shot for anybody who has just had it. And you probably want to wait until you feel like you're back to normal. So I would probably recommend a 2-week wait on that. You could actually have gotten it simultaneously, but I'm not sure you wanted to get double reactogenic side effects. So yeah, but I'm glad you got your shingle shot. It's a very, very effective vaccine as well. And I've seen some horrible complications from shingles in unvaccinated. So good work.
Great. I just had one other question. I know that the boosters are cutting down the incidence of long COVID, but what about the people that have had before the boosters came out and then they have long COVID? Is there any, and there probably isn't, but I'm going to ask it anyway, is there any guesstimate of time that these effects might linger?
So we do know that people that have long COVID are getting better slowly. So there is some optimism that people will get better with time. There's also some interesting work that people who have long COVID and get vaccinated feel better after they're vaccinated. So there's studies looking at that as well. So it's an evolving area. And in fact, CHA is participating in one of the big studies on long COVID. And we have a principal investigator, Janice John, who's recruiting some of our patients into that huge clinical trial. So we will be learning more, and we will be contributing to advancing that knowledge.
Thank you. And can anyone receive vaccinations at the Somerville campus?
So Yes, all of our primary care clinics can administer COVID vaccines. So if you have a primary care provider, or even if you don't have a provider and want to get a CHA provider, you can get vaccinated in our primary care clinics.
Okay, thank you. And I might just add that if you do not have a CHA provider and you're looking for one, you can call the main number of CHA and ask for the doctor finder service, and then they will assign a primary care provider to you. So, well, I guess we're getting kudos for the information. Thank you again, Dr. Bruno-Murtha, and so much to learn, and probably so much to learn still in the future. But thank you for taking the time to come with us and explain all of this information. It's very confusing, and it can be very inundating with everything that you read and information coming from so many different places. So appreciate it. Thank you so much. And thank you everyone for joining us. We'll see you again on the first Wednesday of next month. And we will have information on low back pain, which is probably applicable to every single person. But anyway, thank you so much, and we'll see you then.